Here we will see sensory motor processing in the cord. So let's take a look. We have sensory receptors. That information will be sent through sensory neurons through the posterior root into the posterior side of the cord. This information can directly move towards the brain. It can cross the spinal cord and move towards the brain. Or we can connect to an interneuron as if in a spinal reflex. The interneuron will then directly connect to a motor neuron where it will send output signals to an effector such as skeletal muscle. So if sensory information does move to the brain, we will have a motor neuron through a descending tract come back down to the spinal cord, connect to another motor neuron where it will send information out. This can either be through the somatic nervous system, which again is skeletal muscle only, or into the autonomic motor neuron, which will then attach to a secondary neuron, sending information to the designated organ. The spinal nerves connect to the CNS, to sensory receptors, and all other organs and glands. Again, 31 pair. We have anterior and posterior roots attaching to the cord. Let's take a look at the structure of a nerve. Much like the muscles, we have a different layering system, and we have protective coatings around each layer. So taking the full spinal nerve into account, we have epineurium, just like epimysium. Then we organize axons into bundles, which will be known as fascicles. They are surrounded by perineurium. Within those fascicles, we have individual axons, which are surrounded and coated by endoneurium. And then within the endoneurium is where we see the axon and myelin sheath. Okay, so this is a slide just explaining those definitions. Branches of the spinal nerve. So once we exit that vertebral column through the intervertebral foramen, we will branch into different rami. We have posterior, anterior, and meningeal branches. So posterior ramus, we're mostly looking at serving the deep muscles and skin of the posterior surface of the trunk. Anterior ramus will be muscles and structures of upper limbs and skin of lateral and anterior surfaces of the trunk. Meningeal branch, we will re-enter the vertebral column and supply the structures within. Let's take a look at nerve plexuses. Yes, it is plexuses, not plexi. They are a complex, interwoven network of fibers. The reason we will see multiple nerves connecting with each other, the advantage will be redundancy of innervation. So much like we'll see in the cardiovascular system with multiple routes of blood to a particular location, these plexuses will help serve the same purpose. If one nerve is damaged, we can still have innervation to that particular area because of the redundancy. We have four major plexuses of the ventral rami that we'll take a look at: cervical, brachial, lumbar, and sacral. You can see where they supply: neck and thoracic and thorax, pectoral girdle and arms, and the two lower plexuses, pelvic girdle and lower limbs. So here the cervical plexus is going to extend from C1 to C5. So here is a good example of how we can have redundancy of innervation. The C1 can find its way into C2. We can make our way down into this area and maybe come out to this nerve. At the same time, we're having C2 connect, possibly C3 connect. So we have three spinal nerves connecting into and creating one particular nerve. So this creates multiple fibers from multiple layers or multiple levels. Okay. The biggest one to make note of is the phrenic nerve. This is going to supply the diaphragm for breathing. Brachial plexus. This is going to supply the upper limbs. You can see extending from C4 to T2. We are interweaving quite a bit here. We have multiple nerves supplying multiple areas. 3 main nerves coming from this particular plexus. We have median, radial, and medial, or ulnar. I apologize. Okay, median, radial, and ulnar nerves extending from the brachial plexus. So we can see that here, coming from this area. The ulnar is going to be the medial nerve, supplying the hand and arm. Median nerve is going to be centrally located, moving down into the forearm, supplying the hand. And the radial nerve will be moving down on the lateral side of the arm. Lumbar plexus extending from L1 to L5, conveniently known as the lumbar plexus. Here we see the femoral nerve supplying the femoral area of the lower limbs. You see that here. Okay. The sacral plexus, very large nerve known by most people, the sciatic nerve. So you can see we are having a collection of almost all the nerve roots, L4 through S4. Almost all are going to combine. This will create one very large nerve where if it is aggravated can cause an immense amount of pain for people, and if you've ever gone through it, you know it is very unpleasant, but it is about the size of your pinky. So do know the sciatic nerve coming from the sacral plexus. You can see it is extending posteriorly. We have branches, the tibial nerve, and then the fibular area. Okay. Dermatomes, they are segments of skin supplied by spinal nerves. They carry somatic sensory nerve impulses to the brain. So this means the area on the lateral forearm will carry information through C6 to C6 nerve root. And that information will go to the brain. Now, there are multiple variations of the dermatome chart, so you do not have to try and memorize this particular chart. Just know what dermatomes are. Spinal cord physiology. We talked about white matter tracts. We're conducting impulses to and from the brain. Gray matter, we receive and integrate information for spinal reflexes. Okay, so white columns. So each column is going to contain tracts or fasciculi. Tracts are going to be bundles of myelinated axons. So in the peripheral nervous system, bundles of axons are known as nerves. In the central nervous system, they are known as tracts. Okay? Relay information the same direction. Ascending tracts will carry sensory information to the brain. Descending will carry motor commands to the spinal cord and then to the effectors. Seen here. So blue is going to be sensory information being sent to the brain. Red will be motor information being sent from the brain. Reflexes. Okay, so we're going to see a reflex arc, but reflexes are going to help maintain homeostasis. They're going to help avoid injury. Is going to be the biggest way. Integration will take place in the spinal cord. So we will see sensory information being brought to the spinal cord, an interneuron in the spinal cord, and then motor output from the spinal cord. So no information is necessarily sent to the brain. Okay, that reflex arc starts with sensory receptor. We receive information, we send it through a sensory neuron. Then the interneuron is the integrating center. That information will then be sent out motor neurons. And then finally we reach our effector that will carry out that command. Okay, some vocabulary terms. We see ipsilateral means same side. Contralateral, we will have connections to the opposite side. Monosynaptic, one synapse in the CNS. Polysynaptic, multiple synapses within the CNS. And reciprocal innervation, simultaneous contraction of an antagonist and then relaxation of the antagonistic muscle. That should be agonist. I do apologize. So first off, stretch reflex. We are controlling muscle length by causing muscle contraction. So if we stretch this patellar ligament, we sense an overstretch of the muscle. So to avoid injury, we will contract the quadriceps, and this is where we get the reflex. So contracting that quadriceps causes extension of the leg, showing that the reflex is intact. Okay, tendon reflex, we control muscle tension by causing muscle relaxation. The tendon will sense too much stretch, and to avoid injury, we relax the muscle. Think of when you go to pick up a bucket. If that bucket is full of some kind of heavy material and it is too hard to pick up or too heavy for your muscle can give out, and the antagonist muscle will contract to move the other muscle away from injury. Flexor or withdrawal reflex. This is one we probably all know too well. We move a limb to avoid injury or pain, drawing to the center of the body. So say you stub your toe, we will pick that foot up, flex the leg towards the body to avoid injury. Just as if we were to touch a hot burner on the stove, we're going to automatically flex our forearm to bring it closer to the body, withdrawing from the pain. Cross extensor reflex. So take that toe stub scenario. We will flex one leg, but at the same time, we have to extend the opposite leg to maintain balance. So cross extensor is for maintaining balance. One leg flexes, we have to stay upright to maintain homeostasis. So we extend the other leg. Some clinical situations. If reflexes are not intact or they are abnormal, it may show some damage to a particular pathway along the nervous system. Homeostatic imbalances, we can check the degree of spinal cord section and depends on the degree of compression of the segments that are involved when it comes to traumatic injuries. And that is it for that chapter.